Yeah, that's a very interesting question because there are some genetic alleles that have been found to be overexpressed in treatment refractory depression that are related to the metabolism of folate, and it's the what is it methylene folate hydroreductase enzyme, and for folate to be used to make neurotransmitters, it has to get to the methylene folate state. And there are people that have a deficient or an allele that is not very efficient at going from folate to methylfolate. And there are other factors that can also reduce that. Do I order folate and methylfolate levels? Not yet as a part of my clinical practice. There are times when I've ordered what's known as pharmacogenomics on patients which has that allele, as well as another allele that's related to the actual implementation of that folate. Again, it's hard-pressed to call that evidence-based medicine in the sense that it's not in this generic, well, everybody with depression has a MTHR deficiency. On the other hand, for that individual patient, whenever I put them on methylfolate and they begin to respond to a drug that they've not responded to because they didn't have the machinery to create the neurotransmitter, for me that's evidence. And so Blue Cross Blue Shield doesn't like it, and I understand that. And so the individual in those situations has to kind of pay the freight on this test. Sure. We have on my inpatient unit we have a nutritionist that sees our patients. But let me just go back, take it one step back further. The vast majority of my patients that have some significant nutritional deficiency, the result is they're either not eating or they're overeating. And it's not the genetic sort of. I don't need a panel of vitamins, levels to kind of figure it out. On the other hand, there are times when I order those vitamin levels, like B12, folate, sometimes thiamine, and for instance, we had a patient that we made the early diagnosis of. Sounds terrible, but pellagra. It's just that she wasn't eating a regular diet. But there are some physical exam features of that you can pick up on.